All right, let's talk NCLEX. If you're prepping, you already know those maternal and neonatal questions can be, well, they're tough. That's why today, we're going to give you a little preview of the exam coach's framework to show you a much smarter way to handle this super critical topic. Okay, first things first, we got to get our heads in the right space. See, the NCLEX isn't really about remembering what happens in which trimester. Nope, it's all about testing your ability to spot danger. It's a huge shift from just memorizing facts to actually recognizing risk. And listen, the stakes are incredibly high, right? In a real hospital, missing one of those little signs can have huge consequences. And on the exam, it's literally the difference between passing and failing. The whole point of the NCLEX is to see if you're the kind of nurse who catches those red flags before things go sideways.
So really, it all boils down to this. It's great that you can define preeclampsia, but what the NCLEX really cares about is, do you know the very first thing you need to do when a patient shows those signs? That's what matters. It's all about action, what comes first, and keeping everyone safe.
And that's exactly why we're here. We're going to give you a sneak peek into how the exam coach's platform takes this huge, kind of scary topic and breaks it down into a super clear, actionable framework that's built from the ground up for the NCLEX.
So let's get real. Why are these maternal-fetal questions so tough? You're not alone in thinking that, trust me. It's a major point of confusion for a lot of people. Let's dig into why.
Do any of these hit home for you? Like getting placenta previa and eruptio placenta mixed up when the clock is ticking? Totally common. Or maybe you've memorized like a million risk factors for gestational diabetes, but you freeze up trying to figure out what to do first. That's the chaos we're here to fix.
And this right here, this is the core idea. The NCLEX is not trying to trick you, I promise. It's just trying to make sure you're going to be a safe nurse. So your job isn't just to name the problem, it's to see that your patient is unstable and then do something about it, safely and right away.
Okay, and this is where our approach at Exam Coaches really shines. We're about to show you our prioritization framework. It's designed to take all that confusion and chaos and turn it into total clarity.
Take a look at this. This mind map is really the heart of our framework. It takes dozens of different conditions that feel totally separate and connects them all by risk. You can see how we group everything, risks, complications, what you need to do, into one easy-to-follow system. And honestly, today we're just scratching the surface.
Let's jump into a classic point of confusion, early pregnancy bleeding. Check out how we break down these high-risk conditions. An abortion? You're looking for clots. An ectopic pregnancy? That referred shoulder pain, that's a massive red flag for a rupture. And then you have a Hydatidiform mole, with that classic snowstorm on the ultrasound and a fundal height that's just way bigger than it should be. These are the exact signs the NCLEX wants you to catch.
So when you see a question like this, it makes you stop and think, right? What's my first move? Assess for shock? Get ready for an ultrasound? Our framework trains your brain to instantly think stability. You're checking for signs of shock, a falling blood pressure, a climbing heart rate. You learn to put patient stability above everything else. Now let's build on that. The framework also helps with those ongoing conditions during pregnancy. It organizes all the key red flags you absolutely cannot miss. So for anemia, we're not just talking fatigue, we're talking a hemoglobin under 10. For a patient with heart disease, a new cough isn't just a cold, it could be pulmonary edema. We train you to see these symptoms for what they are, urgent alerts.
Okay, here's another one. A pregnant patient with gestational diabetes says she's dizzy and her heart is racing. Now that could be a lot of things, but what's your number one immediate concern here? Hypoglycemia. The framework teaches you to connect the dots between the condition and the most immediate danger. So your first action? You guessed it, check that blood sugar stat.
And this is so important, understanding who the priority is. With something like gestational hypertension, the big scary risk is a seizure, so our top priority is stabilizing mom. But then you take an STI, like chlamydia. Of course we treat the mother, but the main safety goal is to stop it from getting to the baby, where it could cause blindness or pneumonia. See how the focus totally shifts?
All right, one last little teaser to really nail this down. This is a total classic NCLEX scenario. High BP and a headache at 32 weeks. That just screams preeclampsia. So, what's your priority intervention? Seizure precautions. That's the kind of quick, spot-on clinical judgment we're talking about.
Okay, so we've touched on bleeding, on chronic conditions, on shifting safety priorities, but how do we wrap all of this up into one simple, powerful idea you can actually use on exam day?
Well, we go right back to our map. You see, from abortion all the way to gestational hypertension,
This isn't just a random list of facts to memorize. It's a single, unified way of thinking. You see a sign, you recognize what could be happening, you prioritize the biggest risk, and you make a fast, safe call. Every time.
And here it is, boiled down to its simplest form. Step 1, detect. Step 2, prioritize. Step 3, intervene. That's it. This 3-step process is your key to unlocking pretty much every single maternal newborn question on the NCLEX. It just simplifies everything.
All right, let's zoom out for a second and talk about the big picture. Because prepping for the NCLEX is about so much more than just passing a test, right? It's about becoming a safe, confident, and competent nurse.
And we want to be super clear about what we do at Exam Coaches. We're not here to just lecture at you or make you read another textbook.
What we do is train you to see what actually matters, to cut through all the noise and spot those tiny signs something is wrong, maybe even before anyone else does.
We train you to know what to do first, so it becomes almost instinct to go for the most critical action, the one that's going to stabilize your patient and protect that baby.
Ultimately, what we're really doing is training you to think the way the NCLEX wants you to think, to use solid clinical judgment that protects both of the lives you're responsible for. And if you take away just one thing, let it be this. When you're in that exam staring at a question and you're stuck between two answers, just ask yourself this: which one is the safest and the fastest? That right there is almost always going to be your right answer.
So this was just a quick peek into how we handle this really complex topic. The entire framework, with all the details, all the practice questions, and all the rationales, it's all waiting for you inside the Exam Coaches platform.